Chair recognizes the gentleman from Tennessee, Mr. Cohen, for 5 minutes.
Thank you, Mr. Speaker. Quite a day. First day of the government shutdown. Americans come to Washington, see the Lincoln Memorial, visit the Smithsonian, go to the National Zoo. They go to New York to see the Statue of Liberty. Give me your tired, your poor, your huddled masses yearning for freedom. Go to national parks, our treasures of our country. Closed. Services tapered down. No new patients to the National Institute of Health. This should not be in America. Government shutdowns are wrong and they're bad for our country. Now let's think a little bit about how we got here. We got here because the job of the Congress, according to the Constitution, is to come up with a budget and appropriate monies. The Republicans have had a budget, and the Democrats in the House have asked for month after month after month after month to have a conference committee appointed so we could work with the Senate and come up with a budget. And the Republicans, even though we had bills, letters, requests, no conference. No, 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 no. Now beyond the last minute, beyond midnight last night, when all of their failed attempts to get a Affordable Care Act, Patient Protection Act, and that's what it is. It's an Affordable Care Act and a Patient Protection Act abolished. Passed 3 years ago. 43rd attempt. It's not going to happen. Reality, it's not going to happen. It's the law of the land. And one day it'll be seen like Social Security and Medicare as one of the 3 greatest laws ever passed by this Congress. But they've tried everything they can to stop it. Defund it. Put it off a year, come up with different prevarications. At the last minute after midnight, they say, we want a conference committee. They can get a conference committee if they come with a clean continuing resolution. And what's in their continuing resolution? $986 billion. The Ryan figures or less. That's what they wanted. It's not what the Democrats wanted. The Democrats want a higher budget. This cuts 17% from health and human services. Programs the government offers to people in need, the safety net, people who more than ever need SNAP payments, need Meals on Wheels, need assistance. We accepted their lower figure for continuing resolution. Even then, it wasn't enough. They put it in all these proposals and abolish the health care bill. You know, when the Republicans came to power about 4 years ago, 3.5 years ago, one of the things they told the American people, we're going to be different. We're not going to have bills that combine different subjects. You know, all you people don't like that, these bills with different subjects that come back from the Senate or passed with the House with amendments. We're not going to do that. And then they come with the bills that are the budget, along continuing resolution, along with abolishing Obamacare. That's against what they said they'd do. They said they were concerned about the debt. And they'd have offsets. No bill could pass without an offset. Nothing could contribute to the deficit. And yet they brought a bill, the continuing resolution, but abolishing the medical device tax, costing the government $30 billion. No offset. In the history on Obamacare, they've been cited by PolitiFact twice for having the governmental lie of the year. One was when they said there were death panels. Panels that simply said that end-of-life discussions could be covered by government payments. A proposal that Republicans put forward, I believe was Senator Grassley and a gentleman from Louisiana. They also said it was a government takeover of health care. It's not a government takeover, it's insurance. It's the plan Mitt Romney put into effect, Bob Dole championed, Richard Nixon championed. It's a Republican plan. Most Democrats would have preferred a single payer, certainly a public option. They're not satisfied with that. Now they're talking about a special deal that Congress people get. Shame on them. I, for one, don't take federal insurance. I have a different program. But for the people in Congress and their staffers, because of an amendment Charles Grassley put on the bill, Senator Grassley, they go into the exchanges and they leave their federal health care plan they've been in. It was subsidized, like employers subsidize health care. Now it is no longer. It's unfortunate. My time's run out. The government's run out. I yield back the balance of my time.
Gentleman's time has expired. The chair recognizes the gentleman from Florida, Mr. Micah, for 5 minutes.
Well, thank